In 2014, Ambrose Bajek-Lapagna sang excerpts from an opera during his own surgery to remove a brain tumor. His procedure was an awake craniotomy. Well, what is an awake craniotomy? A craniotomy is a surgical procedure where a portion of the skull is removed to access the brain. During an awake craniotomy, the patient is woken up for a portion of the surgery. They are told during the surgery to complete tasks to make sure that the surgery doesn't interfere with their vision, movement, or speech. Often these tasks include speaking, identifying, and in Lapagna's case, singing. Awake craniotomy has been around for centuries. Archaeologists have found evidence that this procedure was used at various points in history to treat both medical and religious issues. Some cultures used it to treat seizures, while others used it to help evil air escape from the mind. Today, awake craniotomies are performed to treat seizures and brain tumors. How exactly does an awake craniotomy work? First, the patient's head is placed in a fixed position and an anesthesiologist puts the patient to sleep for the first part of the surgery. After numbing medications are administered to the area and a bone flap is created, the patient is woken up. Well, can't the patient feel pain? The brain actually doesn't have any pain receptors and the surrounding scalp and muscle is already numbed. In fact, most patients say during the surgery they felt calm and safe. Well, once they got past the idea of someone poking around their brain. The brain is stimulated by small electrodes while the patient performs certain tasks. The patient may be told to identify objects on cars or perform certain movements. If they hesitate or do not respond at all, the surgical team knows to avoid that area. Patients have done everything from playing the saxophone to reading. This procedure is used to identify the eloquent areas of the brain that control movement, speech, and other important functions. The surgeon then removes the tumor. MRI imaging is taken during the surgery to make sure the maximum amount of the tumor is removed. After this, the patient is typically put back to sleep while the area is closed up and the procedure is finished. In total, this procedure can take anywhere from 3 to 5 or more hours, depending on the location of the tumor. Hundreds of awake craniotomies are performed each year with success, and a patient can walk out of the hospital as soon as the next day. 6 years after his procedure, Bajek-Lapagna is doing well and continues to sing. If you would like to watch him sing during his operation, I left a link down below as well as websites with a more detailed summary.